Okay. Okay, the video got cut off, so I'm going to resume where I left off. Here was the preocular lymph nodes, and whenever I palpated it, I did not feel any abnormalities, and she did not indicate or signify any pain. This is her post-ocular lymph nodes. I do not feel any enlargements or abnormalities. Do you feel any pain?
No.
Okay. Then I'm going to check her tonsillar lymph nodes, which are below her ear, kind of by her cheek and jawbone, which would be like down in here. I don't feel any abnormalities. Do you feel any pain?
No.
Okay, then I would check her occipital lymph nodes, which would be back here behind her ear towards the base of her skull. Do you feel any pain?
No.
And I do not feel any abnormalities. Then I would check her submental lymph nodes, which would be underneath her chin. I do not feel any abnormalities. Do you feel any pain?
No.
Okay. Then I'm going to check her submental lymph nodes, which would be below her chin but closer to her neck. I do not feel any abnormalities. Do you feel any pain?
No.
Then I would check her superficial and posterior cervical lymph nodes. So I'm going to have you turn your head and look this way. And I do not feel any abnormalities. Do you feel any pain?
No.
Okay, then I'm going to go ahead and check the deep cervical lymph node chain. I don't feel any abnormalities. Do you feel any pain?
No.
Okay, and then I'm going to check her supraclavicular lymph nodes, and I do not feel any abnormalities. Do you feel any pain?
No.
Okay, then I would proceed with checking out her eyes' mucous membranes. So first, whenever I check out her eyes, I'm going to point out her palpebral fissures, which are here, and open your eye, over here. And then I'm going to do a confrontation test. So by doing this, I'm going to have you look straight at me, and I'm going to hold up a number, and I need you to, with my fingers, I need you to count the numbers when you can see them by just looking straight at me. Don't move your eyes, okay? 1. Okay, and then I'm going to 2. 3. Okay. 4. Yep. Okay, and she passed that test, which is the expected finding. Then I am going to check her eyes for the reflex and reactiveness to light. First, I'm going to measure her pupils, which prior to constriction, they are about 4 millimeters. So if you look straight at me, I'm going to shine this light in your eyes and make sure that your eyes constrict as expected. Her pupils are reactive to light, and also when I shine the light into her left eye, her right one simultaneously constricted with the light shining into the eye, which proves the consensual reflex to be intact. Then I'm going to check her 6 cardinal fields of gaze. So by just looking at me, only moving your eyes, not your head, I want you to follow this pin light, okay? Okay, and no nystagmus was noted, which is an expected finding, and that would have been testing the 6 cardinal fields of gaze and checking for the twitching and the shaking of the eyes, which is common with nystagmus. Then I would go ahead and I would check her ears. And I note inside, I'd pull up. I don't notice any serum, no earwax, no excessive drainage. Do you have any pain in your ears? No. Same applies to the other side. Then I would check in her nose. Do you have any frequent nosebleeds?
No.
No drainage?
No.
Nothing was noted on that. Everything is within expected range. Then I'm going to have you open your mouth. Membranes are pink and moist. I don't notice any swelling. Teeth are intact. No cavity seen. Can you stick out your tongue and move it side to side? Like that, yep. That shows the intactness of the hypoglossal nerve. And then, do you have any tooth pain, jaw pain, trouble swallowing? Do you have frequent nosebleeds?
No.
Okay, those are all expected findings. Her lips are not cracked, dry. They appear moist. Her skin is appropriate for ethnicity. I'm going to go ahead and palpate her maxillary sinus now, or her frontal sinus. Do you have any pain?
No.
And I don't notice any enlargements, no lumps, bumps, no edema. There are no ecchymosis, no erythema. That was her frontal sinus. And then her maxillary sinus, I'm going to go ahead and palpate this. And I do not notice any edema. I see no ecchymosis, no erythema.
Let her go. Go. Let her.
No lumps, bumps, no abrasions. Did you have any pain?
No.
Okay. And then I'm going to perform the whisper test on each ear. And I'm going to see if she can hear what I'm saying when I test each ear.
Yeah. Hi.
Okay. She heard me both times. And that is my assessment of her skin, hair, nails, head, face, neck, eyes, ears, nose, throat, mouth, and her overall integumentary system. This is part 1.